The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD Warriors. I'm Tony Urbanek, and this is TMD Demystified, and we're here for the next episode. Today, we are going to discuss the topic of, this is the title, the topic is a little deeper, titled TMD, What is Needed and Wanted. Specifically, what is needed and wanted from the patient and what is needed and wanted from the provider. TMD, what is needed and wanted. And we're going to discuss that as it applies to the doctor, provider, and we're going to discuss it as what that means to and applies to the patient. Let's talk about the patient first. I had this set up here, but a little differently, but on second thought, let's talk about what TMD, what is needed and wanted regarding the patient. We're not going to talk about the symptoms again, and we're going to talk about the generalities, what's needed and wanted. You have a patient, male or female, who has tremendous anxiety regarding their problem, whether it be immediate anxiety because they can't open their mouth, or because they're having these excruciating pains, or anxiety because they've had this problem for 20 or 30 or 40 years. And I have a few 80-year-old ladies or 70-year-old females who have had this problem for 50 years. Again, most of you, probably all of you who are listening to me, you find some of the things I might say amazing, but the deeper I got into this, the deeper it got. It was a real rabbit hole, absolutely a rabbit hole. And I continue to be amazed about what I see and hear from my patients and from some of the providers who are attempting to duplicate what I have done and am doing. But let's not go that direction too deeply. Let's just talk about the patients and what they need and want, excuse me, itchy nose, regarding their care and this thing that they call TMJ. I have so much information on this because I see these patients, I've seen these patients for so long, and every patient is different. I've never seen the same patient with the exact same description or symptoms, but they all run together extremely similarly. We've talked about how there's really nothing new under the sun, moon, and stars regarding TMD once you understand the problem itself, where it arises, and then how to address it and how to treat it well. All right, so what is needed and wanted from our patients who have this thing that they call, and most everybody else calls, TMJ? They don't know everything that we know. They don't. That's the one thing I have to keep reminding myself when I'm sitting there talking with a patient. They don't know what I know, and that part of my effort is to enlighten them, to teach them as to at least part of what I know, so what we do and what I say makes sense. So they want treatment. They just want whatever those symptoms are to go away. They want the ringing to go away. They want their headaches to go away. They want their neck pain to go away. They don't know anything about it except they have these terrible symptoms. I had one patient yesterday. The major complaint from this patient was their ears were full all the time. She had most of the other symptoms, but her major complaint was subjective hearing loss. And my ears are full all the time, and the ENT doctors don't know what to do about it, and they check my hearing and blah, blah, blah. All right, so first of all, they want something that's easy. And some of them are willing to accept things that are very difficult to do, which that isn't what we do here. But I have to make the comment that what I am faced with multiple people, many patients who have seen many other providers who want to do really complicated things. I mean, complicated like totally reconstructing their dental occlusion with crowns and bridges, orthodontic treatment that goes on for 4 or 5 years, multiple splints, upper splint, lower splint that change from time to time, and treatment plans that can go on for 4 or 5 or 6 years, phase 1, phase 2. You probably all heard these statements or monikers. But what the patient wants is something that's relatively easy. Does what we do here, does this device, is it relatively easy? Yes, I claim that, and in comparison to a lot of other things, it's very easy. In comparison to other things that are proposed to treat TMD and even Botox. I mean, a injection of some Botox in your cheek isn't a hard thing to do, but when you have to go back to do it every 4 to 6 months, and you'd have to do it every year for 20 years or 10 years. I had a patient that actually had Botox for 10 years, and finally she gave up and sat in my chair and asked for help. But the patients want something that's easy. They want something that's dependable and predictable. If you understand the origin of all the symptoms, which is inflammation within the temporomandibular joint, and you know how to make that inflammation go away predictably by unloading the joint, then you can honestly say that your treatment is predictable and dependable, in that you can depend that you will get the response if you can make the inflammation go away by unloading the joint. Patients want things that are quick. And I have a little cartoon that I used to show in lectures. It was a little building that looked something like a McDonald's with a drive-through, and there was a cartoon car with a cartoon character sitting in the car with the head of the cartoon character in the side, sitting in the car, but inside the drive-through window. And the description of the cartoon, actually the sign on the little building said Joe's Oral Surgery Center. And the description was get your wisdom teeth out. So if patients could do it, if you made it available where you could actually pull that off safely and effectively, I think there'd be people that would do it. Drive through, take your wisdom teeth out. They want things quick. But what's the definition of quick? See, each one of these items has a specific definition. What is in this regard, in regard to treatment, regarding a doctor's treatment, what is the definition of easy? What is the definition of predictable? What is the definition of quick? Well, if you can handle the patient's symptoms within 2 to 6 months, and within 2 to 6 months, you can predictably make symptoms diminish or go away, proper word is ameliorate symptoms, then you can claim or say that your treatment is quick. Now, is it quicker than 6 years of orthodontics and total rebuild of your occlusion? Yeah. Is it as quick as an injection into your cheek? No. But that's why you have to take all of these things that are needed and wanted by the patient and balance them out as to a balance that gets the patient where they want to go. But definitely patients want things that are quick. They want things that are simple. They don't want things complicated. Sometimes they don't even understand what's simple or complicated. Again, going to the definition. What is simple? When it comes to medical treatment, dental treatment, I mean, you can say, well, class 2 filling is simple. On the other hand, if you understand all the steps and all the knowledge you need to do a prep and to pull off a successful class 2 filling, restoration, you could say, well, that's complicated. Well, depends on your point of view. But from the patient's point of view, they want things that they consider simple. Well, a device that looks like a retainer, obviously not, that fits in the roof of the mouth, that they have to wear at the beginning 24/7 for 2 months, and then nighttime only for the rest of their life. I don't know. I consider that simple in comparison. In comparison to temporomandibular joint surgery, absolutely. And because I have been so familiar with temporomandibular joint surgery, both external and through a scope surgery, 2,000 times, 2,000 plus times, because I've done at least 1,000 of each temporomandibular joint surgeries, half of them through an incision, through an extra facial extraoral approach, and half of them through an arthroscope. So I know I can't be smoothed by doctors who say that, surgery is easy. Well, your point of view, if you've done over 1,000 of them and it takes you 30 minutes skin to skin to do an external approach and remove the meniscus or put in a Christensen implant, then yeah, I mean, to me for a while, I thought it was pretty simple. But from the patient's point of view, surgery is a heck of a lot more complicated for them and scary for them, anxiety producing for them, than a simple procedure using a simple device that goes non-surgical in the roof of the mouth that they have to wear according to protocol. Patients want things inexpensive. In fact, if you gave it to them free, they'd prefer that. Our country may eventually end up with, universal health care. I don't plan on ever addressing that directly, my opinion of that, whether I think it's good or bad. I think there are definite valid opinions regarding how that should go. But the patient's point of view is they want it inexpensive. Now, what's the definition of inexpensive? $5.99 is inexpensive. The average fee, and I investigated this because I have not done a recent investigation, but about 5 years ago now, I did an extensive investigation. It didn't take me long with the Google. What is the average fee for a non-surgical temporomandibular joint treatment in the United States of America? And the number came back from several sources, and kind of averaged things out, as $1,800. That was non-surgical, United States of America, coast to coast. And that was 5 years ago. So if you extrapolate that a little bit, I would say with inflation and things that have gone on in the past 5 years, I would say that if I did that investigation today, it would be more than $1,800, probably somewhere in the range of $2,000, $2,200, something like that, maybe. But you can do your own investigation. You can find out for yourself. It's pretty easy now to do with Google. So, but patients want things that are inexpensive. So what's the definition of inexpensive? Well, coast to coast, a non-surgical treatment of any kind for the temporomandibular joint is roughly $2,000, $2,200, I would think, based on my original investigation 5 years ago. Now, is that inexpensive to everybody? No, it is not. In my own practice, seeing 80 to 100 new TMD referrals per month. Like this week, we have, this week we have 28 independent referrals this week, 4-day week, between myself and my associate, Dr. Urbina. That's a lot of patients, but does everyone avail themselves of that fee that we charge? No. Actually, our numbers are everyone comes in who needs it. They all need it and want it. Rarely, I don't think I can remember anybody I did a consult for that said they didn't need to get rid of their symptoms. They all need to get rid of those symptoms. And about 2/3 of them go through with treatment once they're fully educated. And that's important how you do your consult. Mostly educate the patient on their symptoms, how it works, what's going on with this thing that they call TMJ, honestly. So they're not totally in the dark about it. Extremely important with your consultation. I touched on that. I think I did a whole episode just on the consultation and how important it is and the steps of the consultation. But the patient wants it inexpensive. So is $2,000 inexpensive to some people? Yes, absolutely. I mean, I've had patients multiple times. I say what the fee is, and I'm not going to quote my own fee because other doctors can charge whatever the fee they is, and I can promise you that fees on the coast, on the West Coast and the East Coast, especially in New England and California, are much, much higher than what I just said. In the flyover area, and I consider Nashville a flyover area, although it's getting very, 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 very popular, the fees are less expensive. But some people literally are quite surprised when I say my fee, and then I send them up front to talk to my financial manager, and they say, that's a giveaway. Well, thank you. And some people say, oh my God, are you going to charge me that much for that little piece of plastic? I've heard that. And most of the time they come back and say, I can't believe that little piece of plastic actually made all my symptoms go away. That's another story. Inexpensive. What's the definition of inexpensive? What's inexpensive for some people is extremely expensive for other folks. And it truly does depend on how the patient, thinks things of value. It's their opinion, and they're welcome to it. But they want things that are inexpensive. So in a relative basis, instead of $30,000 to $50,000 to totally reconstruct your occlusion, or 4 or 5 years of treatment with multiple splints and plus orthodontics to go with it, which many people have presented to me in our practice here, suggested fees of $30,000 to $50,000 to treat their TMD. And I can give you the names, and I can show you the practices that do that. And so is what we do is a little acrylic device and a protocol spanning over the period of 2 to 6 months. Is that inexpensive? Well, yes, I think so. That's my opinion. But patients want things inexpensive. They want things that are long lasting. They want to know if you're going to treat them, is it just for this month or this year? Well, our statistics show, our analytical statistics, and the independent study done through Middle Tennessee State University shows that, which was done on our, at the time, 3,000 patient list, successfully treated 3,000 patient list. Now it's up to 4,000 patients successfully treated, but the initial study was begun probably going on 4 years, almost 4 years ago, definitely a solid 3 years ago. It was before COVID. The whole thing started with a study long before COVID. So that study has proven, and because it's drawn from people who have had the device for anywhere between 2 and 10 years. And so is the treatment long lasting? Yes, it's long lasting. And again, this is anecdotal. You're right. That's a very important word, anecdotal. It's not science. but it's important. Anecdotal information is important. And yesterday, I saw a patient who came in who had her device for 7 years. It looked pristine. And she was doing extremely well with it, but she came in because she had an upper crown and the device did not fit anymore. The point being that, is the service long lasting? Well, yesterday, anecdotally, I had a patient come in who had a device for 7 years. It was doing extremely well. She had no symptoms at all. Whatever the symptoms were on her symptom list, I didn't detail them out again yesterday, but I asked, how all your symptoms? Oh, they're gone. I put this thing in every night, but I had this crown. It doesn't fit anymore. And I'm just scared. You got to fix it because I'm scared not to wear it. I said, well, that's the right answer. So we're able to adjust it a little bit, and that's all. But the point is, they want things that are long lasting. The device itself, if you always keep it in a case when it's out of your mouth, and if you always keep it clean with toothbrush, toothpaste only, no chemicals, no fluids on it, it will last indefinitely. And yesterday's patient was an example. Patients want to understand what's going on. This is really important, and they may not voice that very often. But when you get them to understand, more often than not, they will thank you for it. I hear that often. It serves multiple purposes. The first two that I can think of is, number one, they understand. And number two, when you teach them the things that they need to know to understand what's going on, which is based on the inflammation and the sequence of domino effects of that inflammation, they thank you for it. And secondly, they have the opinion that you, the practitioner, understand, because I hear so often, I've talked to so many doctors, and they roll their eyes, or they admit they don't understand or don't know what to do, or just when they talk about it, I can tell they don't understand what's going on. They can't describe the problem. They might even offer a solution, but they don't understand the problem. So this understanding, patients need and want understanding. They want, of course, their provider to understand what's going on. And it's pretty obvious to people. People are not dumb just because they don't have a dental or medical degree. And they can pretty much tell when they're talking to a provider who doesn't understand much, if anything, about TMD, jaw joint problems. That's what we call it here. You have a jaw joint problem, not TMJ. Everybody's got TMJs. They want to understand the problem. They want to understand the solution. And so I have always made it a point, as I've honed my ability, and it didn't come all in one day, honed my ability to do a competent consultation, to go over with the patient and watch the patient, not just spit out what I have to say, but watch the patient as I say it, to make sure they're understanding. You can see it in their eyes and their facial expression, and whether they're actually being attentive to you. And I pay attention to those things because patients need it. They need it and want it. They want to understand. They want to understand the problem. So I go through the litany of giving them the understanding of how all those symptoms are connected to inflammation in the temporomandibular joint, and then how the inflammation goes away by unloading the joint in a way that, that makes perfect sense. I mean, sometimes I use the example of, a set of crutches for the knee, unloading the knee and allowing the inflammation to die down. Well, this little device is the equivalent of a set of crutches for the temporomandibular joint. Oh, that makes sense. So, in patient's terms, depending, I had a patient yesterday who was a biochemist, actually decided on her way to medical school. I enjoyed that conversation because I could increase the nomenclature and do a little teaching along the way in terms that she well understood. not everybody can understand what I have to say, like a biochemist does. And the patients want good access to care. And what's the definition of that? I mean, again, we could use my example of the head inside the drive-through window is good access to care. Excuse me, I was laughing at that. I pull up the mental picture of that, and I always found that really funny because I knew some patients would actually do that. But good access to care. Does that mean you have to have a TMJ doctor on every corner? No, you don't want a TMJ. You don't want all the providers in the world to do TMJ treatment, non-surgical TMJ treatment, because most of them probably are not going to have enough interest. And we're working on that, but we need enough of them in a geographic area to provide the service so that you can take a drive within, 30 minutes, maybe 45 if you live out in the country, literally country, to see a TMJ doctor. But, here in Nashville, we have a dentist just about on every corner, and we have 2 dentists on the corner. Dentists, I'm talking general dentists now, general dentists, I mean, they pull their patients from a very small radius of area. And because there's so many, I mean, patients are not going to drive. They don't feel they need to drive more than 10 minutes to go see their dentist. Well, that's fine. That's okay. But you don't need to have a doctor interested in treating TMD non-surgically correctly, within a 5-minute drive for everybody. Not necessary, not wanted. But that is what patients want. That is what the patients want. And so I guess my point about this is this device we call the Urbanic device. We talked about how I was kind of locked into doing that. And the protocol that goes with it actually supplies what's needed and wanted for the patient. But the patient wants a service, in this case, to make those symptoms go away, whether it be their headaches or their neck pain or their locking or their jaw pain or all of them put together. Actually, most of patients that I see have almost all of those symptoms. 6 to 8 of them at least. Many patients, 2 patients yesterday, consults yesterday, checked off on each and every symptom. They want it easy, they want it dependable and predictable, they'd like it quickly, they want it simple, they want it inexpensive, they want their service long-lasting so that they know that it's not going to come back and that they can handle it indefinitely. They want to understand what's going on. They want to understand the problem itself in terms that they can understand it. They want a solution that they can understand. They want to, if you understand the solution, if you understand, well, this is the equivalent of crutches for the joint, or basically all we're doing is, removing the inflammation in the joint. Inflammation will die down if you unload a joint. And they want good access to care. All right, what does the doctor want? What does the provider want? And this is, by the way, I just have to say that, actually I have patients that come to our practice now from an extended period of time. And I have one patient, saw her yesterday again, does a 10-hour drive from Dallas, Texas. And I think I've mentioned this before. And, those are the patients you really want to try, to really give extra service for, because they're counting on you because of, she's not coming here 10-hour drive because she could find what she needed in Dallas, Texas. So, but my point was that I find that an increasing number of patients are watching the episodes in this podcast. I think it's great. I think it's wonderful, but I've been trying to gear these things to doctors, to providers, to educate the providers so that they understand this problem. Happy to educate the patients along the way. All right, so what do providers need and want? And this is again, I gear it toward providers, and that's why I say this. I won't make excuses for anything that I say that patients may be overhearing, and I would, and I know that providers, both physicians and dentists, are increasingly taking heat from patients regarding any number of these things that the patient needs and wants. It's the list I was working from. They're taking increasing heat from the patients, right or wrong, appropriate. But my colleagues in dental field and medical fields are feeling less and less in control and less satisfied with their own profession. And for the patients who might be listening out there, there's another side of this story. Your providers are not happy either about what's the medical system as we have it. Unfortunately, it's not my job, and I'm not these episodes in this podcast is not going to ever go into our medical system, dental system, although it's changing rapidly, changing rapidly. At least as far as what should be. I'm trying to stay away from to confront and agitate people as we go through this. Physicians, providers, what does this device have to offer for providers? You have to be either a general dentist, an oral surgeon, or an orthodontist to adequately understand and use this device and provide it for your patients. First of all, providers want an expanding market. They'd like a large market to promote to. I think every provider in medicine and dentistry, whether they do it themselves or do it via a larger organization, have to promote their service. Think of how much a hospital system now promotes, or the cardiology department of Vanderbilt promotes, or the cardiology of one of our other larger facilities here, St. Thomas, promotes their cardiology services or other services. So whether the doctor does it himself as a general dentist on the corner, or whether it's a huge organization that has 600 or 700 doctors within their organization, they find they have to promote. So, what we'd like is a larger market, to promote as many people, to as many people as you want, and to serve as many people as you can. The TMD is a huge market. As I've stated many times, 45% of females in the United States of America have temporomandibular joint symptoms. Most of them have been misdiagnosed one way or another as having those symptoms related to some other diagnosis, like migraines and Meniere's disease. Very, very common. But the physician wants a large number of people that he can, or the organization can, market to. Physician would like, and the provider, we'll just call them providers. Again, in this case, it's going to be limited. Who I'm speaking to are dental providers, orthodontists, oral maxillofacial surgeons, general dentists. They ideally would like a niche that they can, call their own, or at least not necessarily have a monopoly on, but can emphasize that they do something different than the competition. And there's so much competition, as I said, in Nashville, there's one or two dentists on every corner nowadays. Well, treatment of TMD and the treatment successfully of TMD with something that's simple and easy to understand from both the practitioner and the patient's point of view is definitely an advantage. What sets the practice apart? Well, if you can actually treat those TMD patients, it will set you apart definitely from whether you're an oral surgeon and you're practicing primarily office oral surgery with dental implants and extractions, impactions, wisdom teeth, or you're an orthodontist and you're doing, everyday orthodontics on 12 to 18-year-old kids, and then occasionally adults. And then occasionally you have an orthognathic patient that has a complicated problem with an open bite or an orthognathic jaw growth problem. Or where you're a general dentist who spends most of your time seeing patients one at a time to do operative dentistry on teeth. It's 90% of your practice if you're in general dentistry. To have a niche that you can set yourself apart from your competition. Nowadays, every practitioner would opt to have a service that is not covered by insurance. And I've touched on that before. I don't want to go deeply into it, but I certainly am I don't have any problem insulting insurance companies. Neither the patients nor the providers are fans of insurance companies, I can assure you. And if you have a service that is effective and simple, that is not covered by insurance, that you're proud of delivering, then you have a big advantage. And that is exactly what this is. It's not covered by insurance, and it really works. And it's a really big plus for the practice. The doctors want the satisfaction of, as I just mentioned, they want the satisfaction of actually providing a service that makes them feel good. I mean, as a maxillofacial surgeon, I always enjoyed and really felt good when I was able to pull a facial skeleton apart and put it back together and change the function and profile and appearance of a face, whether it be after trauma or after growth problems. Made me feel really, really good. I was really satisfied, but very rarely did someone come back after I did that and just give me a hug and thank me and, come into tears because they're so grateful. That rarely happened, although I can't say it never happened as a maxillofacial surgeon. Treating people with this happens all the time, like every day. I'm so grateful. I'm so thankful. And not unusual for patients to break into tears. It happens when they get relief. It happens sometimes even when I offer relief. And definitely it happens when I say, well, we're finished up here. We're going to do a final instruction. Come back and see me if you ever have any more trouble. And, very grateful people. That is worth a lot to a practitioner, at least I think it should be. And then you collecting all those success stories. We document all this. Every provider should document it, and all our success stories and success videos. It's all documented. That's what a provider needs and wants. Doing something via niche that not many providers can actually provide is a huge practice builder, and every provider wants to build his practice. Very few, if any, providers say they don't need to build their practice anymore. That might be happening in the hospital scene where everything is organized and the promotion is going out and the doctors are limited, but very few docs, especially in dentistry, I don't know of any doctors that don't want to build their practice, any dentists, oral surgeons, orthodontists who are still, if they've been in practice 20 years, they still want to build their practice. So it's a huge practice builder, because when you get patients out of symptoms, out of pain, out of their neck pain, make their locking go away, and they've had it for 10 years or whatever. They bring their friends, they talk about you all the time. I had two patients as we finished them up yesterday, truly yesterday, I'm not making this up. Both of them said, I talk about you all the time. It's like, I try to take it humbly. I truly do. But I talk about you all the time to my friends, and I tell everybody about it. That builds a practice. Doctors want to build value into their practice. So if you have a service that is not covered by insurance, that is very active, and you may not have 100 new patients a month, but maybe you only get 20 or 30 new TMD people a month. Well, that adds tremendous value to your practice when you go to transition, meaning, all the doctors out there know what transition means when you get ready to retire or move on. You want to transition, you want to sell your practice, whether you sell it to a DSO or you sell it to an independent doctor or a young doctor or whatever. When you transition, that adds significant value to your practice. And finally, what's needed and wanted is you want a service that integrates well with what you're doing. I mean, if you are a general dentist, it doesn't integrate well if you want to spend some extra time selling real estate. That doesn't work well. But this particular treating TMD with a non-surgical device integrates well. It definitely replaces half the dentists who use night guards and tell patients that it's the treatment for TMD, and just transfer out of the night guards into something that actually works. So what's needed and wanted from our practitioner colleagues? They want something that expands the market. They'd like a niche of their own that delineates them from the competition. No insurance is a huge advantage. Multiple patients who are really grateful, thankful, and tell everybody about you, which is a great practice builder, adds value, and then integrates well with what you're already doing. So commercial, the organic device and protocol satisfies all those needs of what's needed and wanted. So again, I think I've made my point. And this is a very valid episode that describes TMD in real terms. What's really going on out there? What's really going on out there? It's an underserved area. There's 45% of females and a large percent of males who have this problem on a constant basis, and they know they have the symptoms. They don't even know where to start. And sometimes where they start, they're like a pinball. They go from doctor to doctor to doctor and does not know what to do. So what is needed and wanted by the patient? What is needed and wanted by the doctor? We've covered it well. I look forward to the next time I'm able to present a topic related to TMD to our listeners. Looking at the statistics from Dental Town, we have a growing number of people who are watching this podcast, and I appreciate that very much. I appreciate anyone who is watching, listening, your attentiveness. I look forward to speaking with you again. I am Tony Urbanic, and this is TMD Demystified.